Hello, everyone. My name is Alan Hutson, and I'm a shareholder at Crow and Dunlevy in the Labor and Employment Group. First, before we get started, on behalf of Crow and Dunlevy and the entire Labor and Employment Group, I hope that you and your families are staying safe during this COVID-19 pandemic. Second, the purpose of this presentation is to give a quick overview of the two client advisories that we issued earlier in the week related to some modifications that OSHA has made with respect to the respiratory protection standard and the recording/reporting requirements. I am going to cover the modifications to the respiratory protection standard, and Evan Way, an associate in our group, is going to cover the modifications to the reporting/recording requirements. As to the latter, just broadly speaking, again, Evan will get into more detail. The modifications that were made allow certain industries to focus less on the work relatedness of the COVID-19 illness. Again, it gives them a little bit more leeway. It allows them to focus their attention on combating COVID-19 in the workplace as opposed to trying to determine if an employee's positive test for COVID-19 was in fact work-related. Now, with respect to my presentation, again, I'm going to focus briefly on the respiratory protection standard. It's a standard that's been around a long time, and it's designed to protect employees in workplaces that may be exposed to harmful particles in the air. This is a standard that if your employees or workers are exposed to hazardous particles in the air, it's something that you've hopefully already implemented and are following long before COVID-19 became an issue. And just broadly speaking, the respiratory protection standard requires employers that are covered to have a written program to provide medical evaluations, to do fit testing, and to provide training to their employees. So again, broadly speaking, those are kind of the four requirements that are required if your workforce is covered by the respiratory protection standard. With respect to those issues, OSHA did come out with modifications and let their field officers know that are out there enforcing these standards to exercise enforcement discretion with respect to annual fit testing based on the shortage of respirators that are available to healthcare workers and to other frontline industries that are combating the spread of COVID-19. Again, these modifications are motivated solely by preserving as many respirators as possible. And so, if you are an employer covered by the respiratory protection standard, the guidance from OSHA is that their enforcement representatives are not going to issue citations and penalties with respect to the annual fit testing if the employer can show the following things. And I'm going to read them off because there are several. One, the employer can show that they're making good faith efforts to comply with the standard. That's as straightforward as it can be. The employer needs to show OSHA that they are trying to comply with the respiratory protection standard. Two, the employer is using only NEOSH certified respirators. Three, the employer is implementing CDC and OSHA strategies for optimizing the supply of N95 filtering face piece respirators and prioritizing their use. Again, this goes to the whole idea that OSHA's purpose in modifying the annual fit testing requirements is to preserve as many respirators as possible. Four, that the employer is performing initial fit testing on employees. So if you have an employee that is going to need to wear a respirator for the first time, you are required to continue to perform initial fit testing to ensure that it fits properly to protect the employee. Five, the employer is informing employees that annual fit testing is temporarily suspended to preserve respirators. Six, the employer is explaining to employees the purpose of performing a fit check each time they use the respirator. Again, employer needs to show that they've communicated to their employees that each time they put on a respirator, they're ensuring that it fits properly to provide the maximum amount of protection possible. Seven, that the employer is conducting a fit test if the employer notices changes in employee's physical condition that could affect fit of the respirator and explain to workers that a change in face shape could impact the fit of the respirator. So if the employer notices that maybe an employee decided during this pandemic to start working out and eat in a more healthy manner, and that in turn results in a kind of a loss of weight in the face, that employer needs to go to the employee and ensure that the respirator still fits correctly. And then finally, that the employer is reminding employees to inform their supervisor or respirator program administrator if the integrity or fit of the filtering face piece is compromised. So employers need to communicate to employees that to the extent they feel like the respirator doesn't fit correctly or has otherwise been damaged, that they can go to someone and let them know, and the employer can work with the employee to try to make sure that the PPE, the respirator, fits correctly. So why is all of this important? Because basically I've gone over a bunch of things that if you're already covered by the standard, you understand. It's important because OSHA has made clear that if an employer is requiring its employees to wear respirators, they are covered by the standard. And in light of the COVID-19 pandemic, there are a number of workplaces, there are a number of employers that are requiring their employees to wear respirators at work. These are employers and workplaces that aren't normally covered by the respiratory protection standard. So for instance, if you have an accounting office, clearly not going to be covered by the respiratory protection standard, but in light of COVID-19, you've decided that all employees in that accounting office have to wear a respirator. You have unilaterally subjected yourself to coverage under the respiratory protection standard. And that's a problem, right? Because if you're that accounting office, you are completely oblivious to the respiratory protection standards, and you certainly are not complying with those standards. So what can you do to avoid this issue? If you have required employees to wear respirators, or you are contemplating requiring employees to wear respirators, and you are not otherwise covered by the respiratory protection standard, you need to communicate to your employees in writing that wearing a respirator at work is voluntary, meaning the employer is not requiring or forcing the employee to wear a respirator at work. Once you have communicated that to employees, if you have employees that choose to voluntarily wear a respirator, you then have to provide them a form that is found in Appendix D of the Respiratory Protection Standard. And that form is, there's a link to that form in the client advisory that we issued earlier in the week, where you can find it on the OSHA website. So again, there are two things you need to do to avoid coverage under the Respiratory Protection Standard if you are not otherwise covered. One, you need to communicate in writing to your employees that wearing a respirator at work is voluntary. It is not required by the employer. And two, if you have employees that so choose to wear a respirator at work, that you're providing them the form found in Appendix D that outlines some of the things you should understand with respect to wearing a respirator and ensuring that it fits properly and upkeep and things like that. So again, if you're not doing that, you need to do that as soon as possible. The consequence of failing to follow the respiratory protection standard comes in the form of OSHA issuing you a citation, which will also have some type of civil fine with it. So there's real money at stake, and there is a real likelihood that you may put yourself on OSHA's radar if it's determined that you're not following, that you're subjected to these standards and you're not following them. If you have any questions or concerns about any of the information contained in the client advisory that we issued, or the information contained in this very brief presentation, please reach out to me or any other attorney in the Labor and Employment group at Crowe and Dunlevy. And everyone, please stay safe.
Hi, I'm Evan Way, an attorney with Crowe and Dunlevy and a member of our Labor and Employment Practice Group. Here to provide you a quick update on OSHA guidance that was released recently in response to the COVID-19 pandemic. So, under normal circumstances, an employer is required to report all occupational illnesses that occur at work on their Form 300s and give those to OSHA. OSHA has came out and said because of the COVID-19 pandemic, they're waiving these requirements with respect to certain industries. Now, if you're in the healthcare fields, law enforcement, which includes firefighting and other emergency responders, or you happen to be a correctional officer or somebody that works in a correctional institution, this does not apply to you. But for all other industries, if your employee comes down with COVID-19 and it's not readily traceable to that employer being able to show how that employee contracted COVID-19 at the work site, then there's no requirement to report that on the Form 300. And this is because the OSHA recognizes that it's very difficult right now to trace how somebody contracts COVID-19, especially within the work environment. Now, if you had a situation like a ship and your entire crew works on that ship, and it happens that nobody gets off that ship and nobody gets on that ship, and somebody contracts COVID-19 and it spreads to other employees, that'd be an incident where you have to report it. So there's three main criteria that OSHA's put out, and it says there's a confirmed test of COVID-19. That means that as defined by the CDC in a CDC test, somebody has COVID-19, not symptoms of COVID-19, not they think that they have it and they decide to self-quarantine. They have an actual positive test for the virus. The second requirement is that you're able to trace it to the workplace. So it's a workplace illness that arose from them being in the workplace, contracting it from another employee, from somebody that they interact with, like a customer, or along those lines. And the third requirement is that they missed work, or they had to go home, or it was something more than first aid that required them to respond to having this positive. Now, most people, if they have a positive response to COVID-19, are going to automatically self-quarantine. So that last one is going to be satisfied as the first one under most circumstances. So this is just to let you know that a quick update, OSHA guidance release, they've decided to not enforce many of the requirements of the Form 300 for occupational illnesses. As always, please go to our website at www.crowdunlevy.com for all updates regarding COVID-19, and there's tons of employer resources there that you can go through for free of charge. Thank you.